Hi everyone, this is a detailed video of mine about scleroderma. Well, it is also known as systemic sclerosis, and it's a group of rare diseases that involve the hardening and tightening of the skin. It may also cause problems in the blood vessels, internal organs, and digestive tract. Scleroderma is often categorized as limited or diffuse, which refers only to the degree of skin involvement. Both types can involve any of the other vascular or organ problems. Localized scleroderma, also known as morphia, affects only the skin. Now, I will tell you the symptoms. Uh, Scleroderma signs and symptoms vary from person to person depending on which parts of the body are affected. First of all, I will tell you the symptom related to skin. Well, nearly everyone who has scleroderma experiences a hardening and tightening of the skin. The first parts of the body to be affected are usually the fingers, hands, feet, and face. In some people, the skin thickening can also involve the forearms, upper arm, chest, abdomen, lower legs, and thighs. Early symptoms may include swelling and itchiness. Affected skin can become lighter or darker in color and may look shiny because of the tightness. Some people also experience small red spots called telangiectasia on their hand and face. Calcium deposits can form under the skin, particularly at the fingertips, causing bumps that can be seen on X-rays. Then we may have Raynaud's phenomena. Well, Raynaud's phenomena is common in scleroderma and occurs because of an inappropriate and exaggerated contraction of the small blood vessel in the fingers and toes in response to the cold or emotional stress. When this happens, the digits may turn white, blue, or red and feel painful or numb. Raynaud's phenomena also occur in people who do not have scleroderma. I mean, it can occur independently. And there is already a video on my channel about Raynaud's phenomena. You can see that. Then you may also suffer from digestive problems. Well, scleroderma can affect any part of the digestive system from the esophagus to the rectum. Depending on which parts of the digestive system are affected, signs and symptoms may include heartburn, difficulty swallowing, bloating, diarrhea, constipation, fecal incontinence. Also, there may be patients may suffer from heart and lung problems. Well, when scleroderma affects the heart or lung, it can cause shortness of breath, decreased exercise tolerance, and dizziness. Scleroderma can cause scarring in the lung tissue that may result in increasing shortness of breath over time. There are medications that may help slow the progression of this lung damage. Scleroderma can also cause the blood pressure to increase in the circulation that goes between the heart and the lungs. This is called pulmonary hypertension. In addition to shortness of breath, pulmonary hypertension can also cause excessive fluid in the lungs, feet, and sometimes around the heart. When scleroderma affects the heart, heartbeats can become irregular. Heart failure may also occur in some people. Okay, now I'll tell you the causes. Well, scleroderma results from an overproduction and accumulation of collagen in body tissues. Collagen is a fibrous type of protein that makes up your body's connective tissues, including your skin. Doctors do not know exactly what causes this process to begin, but the body's immune system appears to play a role. Most likely, scleroderma is caused by a combination of factors including immune system problems, genetics, and environmental triggers. Okay, coming to the risk factors. Well, anyone can get scleroderma, but it does occur much more often in women than in men. Several combined factors appear to influence the risk of developing scleroderma. These are genetics. People who have certain gene variation appear to be more likely to develop scleroderma. This may explain why a small number of scleroderma cases appear to run in families and why some types of scleroderma are more common for certain ethnic groups. Environmental triggers. Research suggests that in some people, scleroderma symptoms may be triggered by exposure to certain viruses, medications, or drugs. Repeated exposure, such as at work, to certain harmful substances or chemicals also may increase the risk of scleroderma. And environmental trigger is not identified for most people. Immune system problems. Scleroderma is believed to be an autoimmune disease. This means that it occurs in part because the body's immune system begins to attack the connective tissues. People who have scleroderma may also have symptoms of another autoimmune disease such as rheumatoid arthritis, lupus, or Sjogren's syndrome. Now I'll tell you the complications. Scleroderma complications range from mild to severe and can affect the fingertips. In systemic sclerosis, Raynaud's phenomena can become so severe that the restricted blood flow permanently damages the tissues at the fingertips, causing pits or skin sores. In some cases, the tissue on the fingertips may die. Lungs. Scarring of lung tissue can impact your ability to breathe and tolerance for exercise. You may also develop high blood pressure in the arteries to your lungs. Kidneys. A serious kidney complication that is known as scleroderma renal crisis involves a sudden increase in blood pressure and rapid kidney failure. Prompt treatment of this condition is important to preserve kidney functions. Heart. Scarring of heart tissues increases your risk of abnormal heartbeats and congestive heart failure. Scleroderma can cause inflammation of the membranous sacs surrounding your heart. Teeth. Severe tightening of facial skin can cause your mouth to become smaller and narrower, which may make it hard to brush your teeth or to even have them professionally cleaned. People who have scleroderma often do not produce normal amounts of saliva, so the risk of dental decay increases even more. Digestive system. Digestive problems associated with scleroderma can lead to heartburn and difficulty in swallowing. It can also cause bouts of cramps, bloating, constipation, or diarrhea. Some people who have scleroderma may also have problems absorbing nutrients due to overgrowth of bacteria in the intestine. Joints. The skin over joints can become so tight that it restricts joint flexibility and movement, particularly in the hands. Okay, now I will tell you about the diagnosis of scleroderma. Well, because the scleroderma can take so many forms and affect so many different areas of the body, it can be difficult to diagnose. After a thorough physical exam, your doctor may suggest blood tests to check for elevated levels of certain antibodies produced by the immune system. Your doctor may also suggest other blood tests, imaging, or organ function tests to help determine whether your digestive system, heart, lungs, or kidneys are affected or not. Okay, now I'll tell you about the treatment. There is no treatment that can cure or stop the overproduction of collagen that is characteristic of scleroderma, but a variety of treatments can help control symptoms and prevent complications. First of all, I'll let you know about the medication. Because scleroderma can affect so many different parts of the body, the choice of medication will vary depending on the symptom. Examples include drugs that dilate blood vessels, blood pressure medication that dilate blood vessels may help treat Raynaud's phenomena, as I mentioned in the video about Raynaud's phenomena before. Okay. Also, you may need drugs that suppress the immune system, such as those taken after organ plants. These drugs may help reduce progression of some scleroderma symptoms, such as the thickening of the skin or worsening of the lung damage. Then we can give medication to reduce digestive system. Pills to reduce stomach acid can help relieve heartburn. Antibiotics and medication that help move food through the intestine may help reduce bloating, diarrhea, and constipation. Prevent infection. Cleaning and protection from the cold may help prevent infection of fingertips, ulcers caused by Raynaud's disease. Regular influenza and pneumonia vaccination can help protect lungs that have been damaged by scleroderma. Relieve pain. If over-the-counter pain medications do not help enough, your doctor might suggest prescription medication to control pain. Therapies. Physical or occupational therapy can help you improve your strength and mobility and maintain independence with daily tasks. Hand therapy may help prevent hand contractures. Also, we may advise surgical and some other procedure. Stem cell transplant might be an option for people who have severe symptoms that have not responded to more common treatments. If the lungs or kidneys have been severely damaged, organ transplant might be considered. Okay, now I'll tell you some lifestyle and home remedies. You can take a number of steps to help manage your symptoms of scleroderma. First of all, you should stay active. Exercise keeps your body flexible, improves circulation, and relieves stiffness. Range of motion exercises can help keep your skin and joints flexible. This is always very important, but especially early in the disease course. Protect your skin. Take good care of dry or stiff skin by using lotion and sunscreen regularly. Avoid hot baths and showers and exposure to strong soaps and household chemicals, which can irritate and further dry out your skin. Do not smoke. Nicotine causes blood vessels to contract, making Raynaud's disease worse. Smoking can also cause permanent narrowing of the blood vessel and cause or exacerbate lung problems. quitting smoking is difficult, you should ask your doctor for help. Manage heartburn. Avoid food that give you heartburn or gas. Also avoid late night meals. Elevate the head of your bed to keep stomach acid from packing up into your esophagus as you sleep. Antacid may also help relieve symptoms. Protecting yourself from the cold. Wear warm mittens for protection anytime. Wear warm mittens for protection anytime your hands are exposed to cold, even when you reach into a freezer. It is also important to keep your core body temperature warm to help prevent Raynaud's symptoms. When you are outside in the cold, wear warm boots, cover your face and head, and wear layers of warm clothing. Well, this was my video about scleroderma. I hope you like this video. If you have any question about this, you can post the comments in the comment section. Thanks for watching this video. See you in the next video. Bye for now.